All right. Is our guest has joined? Let me check first. Let's start our talk show. Good afternoon, everyone. How are you? I hope you are in a good condition. I am Dewi Indriyani as the host of the Dewi Talk Show today. Currently, the world is still at war with COVID-19, including Indonesia. Even though there are currently around 4 million people infected with the virus and 142 who died from COVID-19. The topic we will talk today is about COVID-19, pandemics, vaccine, and so on. Today, I had the opportunity to be able to speak directly with the Minister of Health Indonesia, Ms. Cheryl Andrea. Hello, Ms. Cheryl. I'm so happy and it's an honor for me to be able to talk to you.
Hello, Dewi, and hello, everyone. It's good to see you.
It's good to see you too, Ms. Cheryl. How are you?
I'm very well, thank you. And how about you?
I'm fine, thanks. Well, now what are your activities as a health minister?
Now I'm currently intensively providing education about the vaccine to citizens of Indonesia because there are so many people that have not been vaccinated at this time. By the way, have you been vaccinated?
I have had a vaccine, but only once. I plan to get a vaccine in next week. Ms. Cheryl, how about the current state of health in Indonesia? As we know, now it's still the COVID-19 pandemic, which we must maintain health, obey health regulation, and from this pandemic, there have been many victims.
Now it's still COVID pandemic, but as of 28 September 2021, it was reported around 4 million people with confirmed COVID-19, and there have been around 100 deaths related to COVID-19 reported, and around 4 million patients have recovered from the disease. And we are, as the Indonesian government, is working with a World Health Organization to monitor the situation and prevent further spread of disease.
Yeah, the health situation in Indonesia is very worrying at the moment. This pandemic also hampers our activities, especially our work. Is there a pandemic that your work is hampered a lot?
Yes, of course. I can meet with at the same with my coworkers, and I can attend the meeting directly. I'm sorry, like we use a platform to do something, and with technology there must be some obstacles, and of course we'll handle our work, but we try to be professional and still provide information swiftly.
Yes, I also feel what you feel. If there was not a pandemic, maybe we could tell face to face in my studio. I heard you have been infected with COVID-19, right? This news was warm among the public because the health minister was infected COVID-19. Can you tell me how you got infected in the first place?
Yep, that's right. Last month I got infected by COVID-19, and that's a terrible moment. I need to go far away from my family and my friends. I can taste a delicious meal. I can smell my favorite perfume, and I need to bed rest a whole day. It's so terrible.
Of course, it must be very difficult. How do you feel when you know you're positive? Do you feel panic?
Yes, of course. The problem is I have a children. Also, my husband and my parents live in the same place with me. So the first thing I'm thinking about is my family. What if they get infected too? What if it happens because of me? But after knowing I had infection by COVID-19, I went to the hospital to get treatment and immediately do a swab test, and the result is positive.
After you test positive for COVID, is anyone at home infected with the virus?
My child, my husband, and my parents also immediately did a swab test too. But thankfully, they are infected, so I'm glad to hear that. But the sad moment is me and my family is far away.
Yes, of course, it must be very sad. Your demands meeting a lot of people, so it must be difficult. Well, how do you feel when you know you are positive COVID?
Um, of course, I feel sad because I'm the Minister of Health, who should provide for the health of citizens of Indonesia. But I've been affected by COVID-19, and I was very afraid if they turn out to be infected because of me, and I'm afraid that I can't take care of them anymore.
All right. Did you get diagnosed positive with COVID-19 that you felt certain symptoms?
Yeah, I felt the symptoms. It happened when I was eating chicken soto. You know, the smell of chicken soto is so strong, right?
Yeah.
But I can't smell it, and I was shocked because it tastes bland. And after I realized I couldn't smell my food, I started to get restless, but I continued to eat my food. And after that, I tried to taste the salt, smell the perfume, but still no avail. So I thought maybe I was infected by COVID-19, but there are no other symptoms such as fever or weakness.
Chicken soda is very interesting. Are you doing
Yeah.
self-isolation or isolation in the hospital?
Yeah. My doctor gave me suggestions to me to do self-isolation because I need to give more space to other COVID survivors who are in a bad condition and they had to be cared for with doctors and nurses at hospital. So I'm doing a self-isolation at my house, and my family are staying temporarily at my sister's house, which is a bit far from my house.
Okay, so during isolation, you really don't meet anyone? How do you eat or when you miss your family?
Yeah, definitely yes. Like I said earlier, my family at my sister's house, and I only live alone at my home. And if I miss them, I will call them or video call.
It must be very sad to be away from family, but your family must also be sad and wish you a speedy recovery at the time. Usually, people who are infected with COVID run isolation for 40 days, right? So, what do you do during the isolation?
Oh, we give treatment guidelines recommended by the NIH COVID-19, the use of dexamethasone in certain people hospitalized with SARS COVID-19, and the recommendation was based on results from the recovery trial, and patients who required supplemental oxygen or ventilators and who received dexamethasone were less likely to die within 28 days than those who received standard care. And dexamethasone did not have a benefit in patients who did not need respiratory support.
All right. And how about the food you consume during COVID-19?
Yeah, of course, I take my medicine that doctors give to me, and sometimes I also do exercise, get some fresh fruit every day, And if I'm bored, I usually play piano because it's my hobby. Or sometimes I call my friends, or sometimes I read a book like novel and something like that. But still, see the time to not to be tired.
All right, have you received the vaccine? What makes a vaccine important to our bodies?
Yes, I will get a vaccine in 2 months because I just recovered from COVID 1 month ago. And if we are going to discuss about if the vaccines are important, the answer is yes. Because a vaccine can teach your immune system how to create antibodies that protect from your disease, and that's why vaccines are really important.
Now, the progress of the distribution of COVID-19 vaccination is what kind of scam is it?
We have issues regarding vaccine availability. We used to have only 3 million vaccines, which was not enough for 2 months. And therefore, from July, 1 million to 1.5 million injections per day. And our target to inject is 181.5 million or 363.
Wow, that's a huge number. Do you have any difficulty with giving vaccine to the people of Indonesia?
Yeah, the difficulty is because there are those who are abroad or afraid of injection, or the number of vaccine is small, like at the beginning.
Okay, there's been a lot of bad news about vaccines. How do you respond to the notion that vaccines have dangerous side effects?
All right. This vaccine has a more stringent examination process with drugs because the vaccine is intended for healthy people, and this vaccine has a low 3 stage. From each stage is a safety check process, and each of the stage is the test must be reported to World Health Organization and then entered into BPOM. So this vaccine is certainly not dangerous. Because of that, it has faced 2 stages of testing.
Okay, Ms. Cheryl, but because of the bad news, many people do not want to be vaccinated. How do you convince them to get vaccinated?
All right, of course, we will provide an understanding about the vaccines, what the vaccines are used for, and given understanding that the vaccines are not dangerous, and of course the vaccine is free. We don't charge a fee, and if they still don't on it, it's a bit difficult. Yeah, maybe if they have failed to being a COVID patient, maybe they will realize it soon.
Okay, I hope so. And do you think you have a target or an estimate of of our country returning to normal without COVID-19?
Oh, I think this is a difficult question. But the answer for me is I don't know. But I know what's our target. Our target is to reduce the target rate of transmission. That's it.
Okay, finally, last question. Maybe you have a message for audience?
All right. Please stay safe. Uh, take the medicine from the doctor. Don't give up, and don't forget to pray to God. Don't feel bad because you are infected with COVID-19. Because COVID-19 is just a disease, and you or those of you who are survived from COVID-19 will definitely recover. And of course, this pandemic will pass.
Okay, wow, it's nice to talk to you, but unfortunately, time is over. Thank you, Ms. Cheryl, for taking the time
Right.
to share your experience.
My pleasure, Dewi.
Nice to meet you too, Ms. Cheryl. Hopefully, we can
Nice to
talk
meet you.
again with a better situation. Once again, thank you, Miss Cheryl.
All right.
Okay.
All right. Thank you, Dewi.
Okay, ladies and gentlemen, hopefully what was conveyed by Miss Cheryl earlier can be a lesson for all of us. Hopefully it can be a lesson also for all of us that COVID-19 is dangerous, but we can pass it. For those of us who are healthy, hopefully we can better maintain health and of course always adhere to health protocols. And for patients who are infected, do not panic. Surely you can recover and can fight COVID-19. I believe it. Let's fight COVID-19 together. Thanks for your attention. Stay healthy and see you later.